Hello, good afternoon. My name is Mary Ann, and I'm gonna do my head to toe assessment for health assessment 2. Hi, good afternoon. My name is Mary Ann. I'll be your student nurse for today. What is your first and last name?
My name is Ade Julius.
Nice to meet you, Addie. And what's your birthday?
October 11, 22.
Okay, can I see your armband? Okay. All right. Well, nice to meet you, Addie. I am here today because I need to do a head-to-toe assessment. It's gonna take me 15 to 20 minutes, and I have to give you a heads up. I would occasionally need to touch you and like probe you a little firmer. Okay? I hope it's okay.
Yeah, that's fine.
All right. Well, I know that someone already did your vital signs. Are you in any pain right now?
No,
And then, do you have any allergies?
no,
Okay. And before we actually begin the head-to-toe assessment, do you feel like you need to void?
no.
All right. Well, Addie looks her age, and she has a rosy undertone, and her skin tone is appropriate to her race. She is alert and oriented, and she answers my question logically. She looks like she's well nourished. She has a good posture, and Addie, what brings you in here today?
For my health assessment.
Okay, and then do you know what year we're in right now?
Yeah, 2018.
Okay, all right. Well, like what I said, she answers the question logically, and she's alert and oriented times 4. She appears to be calm and relaxed, and she's very cooperative. I'm gonna start my head to toe assessment now. I would start feeling for her scalp. There is no bumps, and there's no obvious lesion on the forehead or anything on her face. There's no face discoloration. She has that rosy undertone. And then upon observation, there is no discharges on ears, eyes, or nose. And then, are you using hearing aid?
No,
Do you use glasses or contacts?
no, I don't.
Do you use dentures?
No,
Okay. And then her nose is in the center of her face and very symmetrical. Her lips has her lips are pink and moist. And then can you open your mouth for me? Open it wider. Can you stick out your tongue? Can you say ah? Okay, the inside of her mouth is pink and moist. Her uvula rises and falls. There's no thrush on her tongue. And her teeth are complete and no sign of decay. And I'm gonna do her perla. Okay. Addie, I'm gonna shine a light in your eyes, okay?
okay.
And then can you follow the tip of my pen? Okay. Her pupils are equally round and reactive to light, and when I put my pen in the middle of her nose, they're accommodating. I'm gonna check for her pulses. Okay. And it is important that we do it one at a time, or else the patient can potentially pass out. So her carotid pulse is strong and steady, and her trachea is on the middle. No JVD can be observed. Her skin turgor is good, no tenting when I pinch her chest. And then I'm gonna listen to your lung sounds, okay? Okay. When I move my stethoscope, can you take a deep breath? Okay. Okay, I'm gonna lung sounds from the back. Okay. 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 No adventitious sounds on the lungs. Lung sounds are clear. She has no labored breathing, and her lungs expand equally. No accessory muscle is used for breathing. She's not coughing and no sign of phlegm. And then I'm gonna listen to your heart sounds now, okay? Her apical pulse is 68 per minute, and they're strong and regular. Can I borrow your hand? I'm gonna check for your pulses. They're +2 bilaterally, and then, okay. The brachial pulse is +2 bilaterally. I'm gonna do a capillary refill. It is less than 3 seconds. And there's no sign of clubbing on the fingernails. Her perforation is good. And then I'm gonna ask you to lay down. I need to listen to your abdominal sounds, okay? All right. Okay. Okay. The contour of her abdomen is flat. There's no, upon inspection, there's no obvious sign of masses or bulging. And then I will need to check the color of your abdomen. Okay. All right. The color of her abdomen is homogeneous color, the healthy pink undertone. And then I need to listen to your bowel sounds. Okay, I would start with the right lower quadrant. Bowel sounds present. Bowel sound present. Bowel sound present. Bowel sound present. So bowel sounds are present on all 4 quadrants. And I will need to probe you a little bit, okay? Let me know if at any point you feel pain. Okay. Upon palpation, I felt no tenderness or masses. And then how often do you void?
Whenever I need to. Like every 2-3 hours.
2-3 hours. And then how often do you release your bowels?
At least once a day.
Once a day. Okay. And then I'm gonna ask you to sit up. Oh, you know what? I'm so sorry. I forgot. I need to check your legs. I'm so sorry. Sorry about that. Okay. I'm gonna check for her lower extremities. Okay. There's no sign of edema on her legs. Okay. Pedal pulse is present and strong. It's +2. Can you wiggle your toes? Okay. And then I'm gonna press on her calves to check for DVTs. There's no obvious sign of redness or swelling. Do you feel any pain when I press your calves? Okay, how about here? No? So no DVT is present. And then Her legs are no edema on her legs. There's no pallor. The pulse is strong. And do you feel any numbness or tingling? No? Okay, so there's also no tingling. All right, I'm gonna ask you to sit up. And then I'm gonna ask you to wear your shoes. Okay. All right. Can you stand up for me? Okay, her balance are good. And then can you walk from here to there? Okay. Her gait is smooth and steady. All right, you can sit down again. So that concludes my head to toe assessment. Addie, do you need anything?
No.
All right, well, I'm gonna leave you to call. Just call first if you need anything, okay? Thank you for letting me do my head to toe assessment.